też.
All right. This is providing Ostomy Care. To start with, I will verify orders, and then I will gather my supplies. I will go to the patient's room. Hello, Mr. Gray. My name is Anna. I'm your nurse today. How are you doing?
I'm doing pretty good.
Oh, I'm doing good, thanks. Can I see that name band of yours, please?
Good.
Okay. Can you tell me your name and full date of birth, please?
Mr. Gray, and 22671.
All right. So, Mr. Gray, today we're going to be changing your ostomy bag. How are you feeling about your ostomy?
It doesn't hurt.
Okay, good.
Pretty good.
Is it a recent ostomy, or have you had it for a while?
I've had it for a week.
Okay, all right. Have you done any changes of it yourself?
No, I don't really like to look at it.
Okay, yeah, that's fair. It's still pretty new. Before we get started, do you have any allergies?
No.
Okay, all right, awesome. So what we're gonna do is I'm gonna remove it, and we'll empty it and make sure so that we can record the amount of stool you have.
Okay.
And then we'll change it so that you have a new bag. Do you have any questions for me?
Not really.
Okay. All right. Here's my straps pad. And I would apply gloves. All right, I'm ready. Are you ready?
Yes.
Okay. Now expose the stoma. And then place the Chex pad under the patient's stoma to make sure that the linen and the bedding don't get dirty. Remove the clamp. Roll back the end of the bag at 2 inches. And Mr. Gray, do you know how long you're going to have the ostomy? Is it permanent?
I think so.
Okay. Then when I got all of the stool into the container, we'll clean the 2 inches here. And then roll it back up. And then when I place the clamp, I want to make sure that the curvature of it follows the curvature of the patient's body. Okay. And I would remove gloves, perform hand hygiene. All right, now we're gonna remove the stoma bag, and you pull off the face or the bag. You're pulling the flange there, and then if it's reusable, you would set it aside to clean it, or if it's disposable, you would now throw it away. Then using pushing the skin away from the dressing or the skin barrier more than pulling the barrier up, you would remove the skin barrier. And then using soap and water, you clean around the stoma. And then using toilet tissue, you clean the stoma itself. Then you would change gloves, apply a skin protectant barrier, and then while that's drying, you measure the stoma. Looks like this one is 1 3/8 inches, so then you add at least another 1/8 of an inch. So I would cut the new wafer to 1 1/2 inches, like so. and cut all the way around. And you'll remove the backing and place it on the patient's abdomen, stoma. And then you will place the new bag, clips on the flange like so. Then, all right, Mr. Gray, that's your change.
And what did the stoma look like?
You want to see that the stoma is red and beefy. That ensures that there's sufficient blood flow to it. If it looks kind of gray or white, then that probably indicates strangulation. And you would notify the provider immediately. We'll document the appearance of the stoma, the appearance and quantity of stool, and that is dependent on where the ostomy is. Mr. Gray, is there anything else I can do for you?
No, I'm good.
Okay. All right, well, I will be back in about a half hour to help you order lunch. Sound good?
Sounds good.
All right. Thank you.